Assalamu alaikum wa rahmatullahi wa barakatuh. A very good evening and welcome to another edition of Health Matters. Chronic obstructive pulmonary disease. What is that all about? The lungs, how it's doing. It's actually a group of pulmonary disease, and we're going to have our specialist a little bit later on discussing that from Cape Town. And I must say, this is something to think of, especially those young smokers who are not really thinking about their lung capacity, their lungs, and what it really is meant to do for them. We know that COVID-19, the coronavirus, does affect your lungs and its capacity. And even surviving COVID-19, there's definitely after effects of it. So we'll hear a little bit later on from our specialists. Please do interact with us via our WhatsApp line. We won't be able to answer all the questions, but we will take it through to our specialists. So please do interact. We rely on you to be part of the show. And remember that you can connect with us if you are a COVID-19 survivor, you have any comments, questions, and special requests of what you would like to see on Health Matters. Our WhatsApp line is available. Chat to us, connect with us. We do apologize. We changed our numbers a couple of months ago, and there were lots and lots of people on our other WhatsApp contact. Please save this number, contact us, connect with us, and send through your questions specific to the program that we're dealing with on our specialists. I know some of them can be quite vague, so if you have as much details, please put them in your questions, and we'll try and get our specialist to answer it. It's a beautiful month of December. We hope that you are safe and well. There has been a spike in the Western Cape, possible restrictions as well, and we understand that people need to follow safe social distance, 1.5 to 2 meters. Do not go out. Help the elderly and those with chronic illnesses if they need essential goods. And remember to wear the mask as a belief. Wear that mask. We want to see that mask on, and sanitize. Have hand sanitizer in your bag. Find out where you can buy it the cheapest for 5 liters and fill your bottles. Give your friends and family if they don't have as well, and hand sanitize or wash your hands. What do they say? Happy birthday twice. Chronic pulmonary obstructive disease is what we're talking about. But before that, let's have a look at our COVID-19 stats within South Africa. Welcome back. As always, we have our weekly wellness. This time we chat to Imam Saeed. Let's have a look. Imam Saeed Malisana, life coach, author, working towards his psychology degree, and also I think, a great community member in our society here in Johannesburg. Jazakallah for your time, Imam. We appreciate it. Assalamu alaikum and welcome back.
Wa alaikum salam wa rahmatullahi wa barakatuh.
So obstructive pulmonary chronic disease is something that affects the lungs, and that's our topic of discussion. We also know that COVID-19 definitely leaves some traces and affects the lungs afterwards. And people have been talking that it doesn't necessarily, they don't necessarily feel the same. Their lungs do not feel the same afterwards. Let's talk about the emotions and the mental impacts of any sort of lung disease or any sort of breathing, less capacity that you're affected with. And also people, why do they go to the extent of damaging any part of their body, and this being, the lungs, a part of their body that they actually really need?
Yeah, first of all, the first part of your question, where you said what are the effects, emotional effects of not only the pulmonary disease but any other diseases, is you find that a lot of people who are ill, if we have to categorize them into two groups, you find there's a group of people that will manage to control their emotions, to be emotionally stable when they are ill. And studies say that these people will manage to or will be able to buffer or will be able to survive better than those people who will let their emotions engulf them at the time when they are ill. So in simpler words, a person gets ill with pulmonary disease or any other disease for that matter, and he just says in his head, in his mind, he says, "This is the end of it. I am finished." It makes matters worse. It makes a person get worse because depression itself, anxiety, and stresses, these also they affect the immune system of the person. And immune system at the time when a person is ill is needed to help a person fight off the disease or to fend off the disease. So the moment a person starts panicking when they get any type of disease, stress levels go high, depression levels go high, they give up on any hope in doctors and medicine in Allah subhanahu wa ta'ala. And when they do that, things only become worse. This is why you find in psychological studies, they mention that religiosity or to believe in Allah and to have patience and to have hope that whatever disease Allah has given you, Allah will give you the cure or there's goodness within it. It's a different approach that we can use if people have this pulmonary disease or any other disease, and studies say that it actually helps. I remember one book that I actually read, the author was mentioning more than 50 studies mentioning that this religiosity or having these religious tools to cope with any disease, it actually makes a person better, maybe even recover from whatever disease they are struggling in. And the second part of the question was, why is it people go to an extent of damaging their lungs, taking on smoke and damaging their lungs? And I actually think that we have to look at the whole issue holistically, because here in Johannesburg and all surrounding towns in Gauteng, you walk in the streets, you find youngsters smoking, you find youngsters even taking drugs, injecting themselves, and so on and so forth. And I don't want us to look at it as isolated cases. I want to look at it holistically and say what are the issues happening here. So you find many youngsters will tell you that they smoke for different reasons, and some percentage will tell you that they smoke because they have issues going around them, and they believe that smoking will relieve them from these problems or from the thoughts that they struggle with. And some people smoke, youngsters do smoke just because of some peer pressure. A friend of mine or the circle of friends of mine, they do smoke as well. So I also want to smoke. I want also to look cool. And now it becomes an addiction, and it carries on. This addiction carries on, and they can't stop this addiction anymore. They carry on. They can't survive without smoking these cigarettes or whatever they smoke. And then they start getting a disease like this pulmonary very dangerous disease, which obstructs the pulmonary passage of a human being.
Understanding the effects and in the depression that you've pointed out, and you often speak about that, and I'm so glad that you point that out. People don't recognize the depression that an individual is suffering from. Going for an addiction, possibly that of smoking or any sort of drug addiction, does it the understanding of depression, does depression kind of lead one to that addiction? And what is sort of the underlying causes of going towards addictions of the cigarettes, of drugs, and not thinking that they're harming themselves?
Into addiction, thinking that they get some kind of relief from drugs, from cigarettes, whatever the case is. And on another hand, you'll find that people actually get depressed because of these things that they take. Like I said, they involve suppression of the immune system, which is vital in fighting off the disease. And then once a person is addicted, now it becomes a circle. It's an unending circle, because they need to feed this addiction. If they don't feed the addiction, they get even more irritated, they get more agitated. They can do anything to get the money so that they can feed on this addiction. So the depression levels, stress levels, anxiety levels go up, go higher. They become more antisocial. So it becomes more and more problematic as long as this problem is not fixed. And it's always like this in therapy, where we look at what is the main cause, and what are the triggers of this of the addiction of drugs or cigarettes or whatever it is, and we have to go back to the cause or the trigger, and we try to work on the trigger and remove the trigger. What triggers this? What makes this person smoke? Maybe it's his circle of friends, then he must stay away from the circle of friends. And I think there is therapies out there with drug addiction specialists that can actually help where they need actually to be in-house and treated of this addiction.
Okay, we are having some sound issues there with Imam Saeed. Jazakallah so much to him, and understanding that depression does play a role and how we can work through that steps of possibly not having any sort of substances, any sort of addictions, and sometimes it's something as small as, you know, when children start licking the wall. I've even reviewed a book where children have addictions to the strangest things. So sometimes adults can as well. This one, we are focusing on chronic pulmonary lung disease, and it's a chronic disease. It's affected, and it's actually a group of them, but we can have the specialist chat to us. But a big shukran to Maulana Saeed, our life coach, certified life coach, and also an individual that plays a big role within the society and community of Johannesburg. He's studying towards his psychology degree and is an author as well. So Jazakallah so much, Imam Saeed. We apologize. There were some technical errors. We lost your sound there, but always a pleasure. Just quickly, your final words in 5 seconds, the way forward for those that do suffer from any emotions and that affects their lungs.
I think that we really need to go and see specialists to help us with these issues, whatever issues we're going through, emotional problems, psychological problems. We can't keep keeping these problems within ourselves. People are dying out there because of depression. It's actually serious, and it's out there. People have stress problems. People end up taking their own lives, and people are not dealing with other people nicely because they have things happening around them. Go and see a specialist, visit a specialist, you know, say that you have a problem, tell them you need help, face it and say, no, I need help, I have a problem. And then this is the only way that a problem can be fixed and society can become whole and better, inshallah.
So understanding, So understanding it's a holistic approach to any sort of chronic illness or disease or depression for that matter. Jazakallah, Imam Saeed, all the best. Enjoy the rest of your day. I appreciate again your time that you've afforded us in today's show. We'll pay the bills quickly, and when we come back, more on obstructive, or at least chronic obstructive pulmonary disease. Back in a moment. Welcome back. A very good evening to you. Assalamu alaikum. Health matters, and we're discussing chronic obstructive pulmonary disease. We will be speaking to pulmonologists a little bit later on from Melomed Hospital out in Gatesville, Cape Town. But another Cape Town guest, Cape Townian, we've heard about quite a spike in the Western Cape, Garden Route and Cape Town area. And we understand that there's been some masajids that have closed down. But to protect your masjid and other masajids throughout South Africa, we now speak to the Imam of the Ottery Islamic Society in the southern suburbs in Cape Town, Imam Fahim Isaacs, and talk about the process that they had taken and the immediate initiative that they had taken to not just protect the masjid, but also the musallis that is attending and the members of the community. Assalamu alaikum to Imam Fahim. How are you doing? And shukran so much for your time.
Wa alaikum salam wa rahmatullahi ta'ala wa barakatuh, and to the viewers of ITV and to yourself, Sister Hawa. Long time.
Yes.
May Allah ta'ala grant us everything that is good. And through this period of the pandemic, may Allah ta'ala protect us all, inshallah.
Ameen, ameen. I hope you guys are well, Imam, you and your family, and keeping safe, I'm sure. I believe the masjid has taken the necessary precautions to keep the musallis safe. Just tell us quickly, at the beginning when COVID-19 had allowed, when regulations were relaxed and the government had allowed places of worship to open once again, what was the first steps that masjids like yourself had taken? to open the
Indeed,
masjids?
Bismillahirrahmanirrahim. Indeed, Sister Hawa, into the use of ITV. Yes, indeed, Ottery Islamic Society Masjid al-Fath, as we know, in fact, we have received quite a few calls from Johannesburg as well, and asked me that Imam, are the masjid closed? We believe the masjid is closed in Ottery. So he said yes, it is closed because of certain health reasons, and we had to take the necessary precautionary measures because of this pandemic, COVID-19. It came to our attention that quite a number of people in the Ottery area were tested positive with this COVID-19. And when we heard about this, we decided, to take the initiative and to close the masjid for 3 days at least. We closed it Tuesday, last weekend Tuesday, and we were closed Tuesday, Wednesday, Thursday, and Friday morning for Fajr we opened the masjid. And what we did was, because Islam teaches us, about safety and health perspective and all of those issues, we decided let us rather close the masjid and let us sanitize the entire masjid, because it's not only the masjid where people come to make salah. We have the Hafiz school, which is in the morning till the afternoon. We have the high school, the Oracle Academy, that is also on the premises. We have the madrasa during the week in the afternoons, from Monday to Thursday. And we have many other activities as well. So what we then decided, let us rather close the premises, let us sanitize and do the fogging of the entire premises, and send a notice out and let people know we will be closed for the next 3 days, but inshallah, we open up Friday morning for Fajr Salah, which was Friday past. And alhamdulillah, we did that, and people, returned to the masjid. But what we need to understand is, there are many masajids, Sister Hawa, and to your respected views of ITV. There are many masajids that are not really by the means, to be able to sanitize the masjid after every work. And it's costly. There's money involved. Unfortunately for us at the Ottery Islamic Society Masjid al-Fath, we sanitize our masjid after every work. So people will come into the masjid, make their sunnah, we make the farol. There's no real lengthy time between the sunnah and the farol. And after the farol salah, we ask people to leave immediately so the masjid can be sanitized. So this are being done, 5 times a day. And you can imagine these sanitizers and all of that does not come cheap. It's costly. But alhamdulillah, so what we did was with, as you know, in Ottery, we have quite a number of doctors that stays in the area. Okay. So we consulted with our doctors, and we consulted with another medical doctor from Tygerberg Hospital, and and lengthy discussions, nearly to an hour, and we decided, what, Ottery Masjid al-Fath is in very safe hands, in the sense that we have the benefit to have been able to sanitize the masjid after every work. So what we can do is close the masjid for 2 or 3 days and reopen again, on Friday morning for Fajr Salah. If we did not sanitize the masjid previously after every work, then we would have had to close the masjid for at least 7 to 10 days for that matter. Okay. And so we can see we encourage people, even our elderly, we encourage the elderly people rather stay at home, make your salah at home, bi'idhnillah, inshallah. Allah will still reward you, and Allah knows why you're not coming to the masjid. We also encourage the sickly, do not come to the masjid, stay at home, and we try to follow all the necessary protocols where the COVID-19 is concerned. In fact, there is quite a number of masjid that has been closed in the Western Cape in particular, and also because of people being infected with this COVID. And it is very, very difficult to really pinpoint, and to say, you know what, no, that person got infected in the masjid.
Yes.
It's
Imam?
really difficult.
Imam Fahim, I just want to quickly understand, and shukran so much for that detailed explanation. We just have a few minutes left for the interview, but currently the mosque is a hub in that community. It has school, it has a Hafidh, it's a Hafidh school, it's actually primary, high school, is it high school, the musallis, so it's a community hub. So let us quickly understand, is the masjid currently open for musallis and the school, and is operational at the time? Right now.
The masjid is currently open, alhamdulillah. The Oracle Academy is also open. The madrasa in the afternoons is also open. The Hafiz school in the masjid is also open. But like I said, for all of these entities that is part of the Ottoman Islamic Society, or rather that is happening on the premises, there are strict protocols, that needs to be followed by the educators, by the heads of these institutions, so they can make sure that all the COVID-19 protocols are being followed, because for the health reason, and also to make sure
protecting,
nobody else are to be blamed for not obeying to the COVID-19 protocols.
Alhamdulillah. So Imam, just
everything, alhamdulillah, is running very.
So Imam, just quickly in your words now to the rest of the Muslim community and to other religious sects that are opening their places of worship, what is your message to them, the attendees and those, alhamdulillah, your mosque is is able and with the necessary support that you have from the members of community to be able to financially carry that restrictions and that necessary sanitation that's happening. So please, what is your message to viewers of other places of worship that are attending and those that you maybe just want to give a warning to quickly?
Yes, indeed. I just want to say to all those institutions, whether it is schools, high schools, masajids for that matter, I would encourage them, please follow the strict protocols of this COVID-19. It's not only for yourself, but it's for everybody else that is frequenting the masjid or the Hafiz school, coming to the masjid. If we follow the strict protocols, Allah Ta'ala will guide us and Allah Ta'ala will protect.
Amen.
Keep your social distance. Hand sanitizers entering of the masjid. And I want to encourage people, even those that are smoking, because this is health matters. Smoking is a no-go. Even if you're a smoker, and you used to go to the masjid, I would say to the person, rather stay at home or brush your teeth or go take a shower, because a smoker, a person that smokes, he can even carry this virus so quickly, than anybody else that is very, very, very sick for that. So my appeal will be follow the strict protocols of COVID-19, stick to the rules and the regulation, because we don't want to be in a situation again where all the massages are being closed again for quite a period of time. If the massages are open, now it depends on all of us that frequent the masjid to make sure we follow the strict protocols of COVID-19, inshallah, because our health are important, and Allah will question us.
So Imam, absolutely a beautiful message, and to reiterate that, Imam, if there's any other massages, other places of worship that would like to contact you, how can they connect with you via social media, or yourself personally, or your committee, just to find out how things are running?
They can contact me personally, or get in contact with the masjid, inshallah ta'ala. We will be able, and we are by the means, inshallah, to be able to assist other massages that find themselves in difficulty, that do not have the support of the sanitizer on a regular basis. But we can assist, and we can, put them in contact with the relevant people, inshallah.
Jazakallah, Jazakallah.
So they
Shukran.
can come to the masjid, contact the masjid, or they can get the details by ITV, inshallah.
Yes, we will forward it. We appreciate your time, Imam Fahim, and all the best to you and your members of community. I believe there's, as you said, there's quite a bit of a medical fraternity assisting yours, and we hope that they're able to assist others as well who are in need that still would like to operate. Otherwise, please, your home is the safest place. Shukran to Imam Fahim Isaacs, the resident Imam at Masjid al-Fath, that's at Artery Islamic Society. It's a community hub that's happening at the Artery Islamic Society, not just a masjid. They have a school there, they have a madrasa, they also have a hifz classes, so it's still running, it's operational, but they can take the necessary regulations and to follow through to sanitize after each waqt, and we hope that most masajids are able to, but if not, please do connect and find out from Masjid al-Fath and Imam Fahim Isaacs and the rest of his team, community and committee members, how they are following and doing their bit to keep the community of Cape Town Artery safe. We'll pay a quick air break, and when we come back, we speak to our specialist in obstructive pulmonary disease.
Understanding Chronic Obstructive Pulmonary Disease, COPD. Chronic obstructive pulmonary disease, or COPD, is a lung disease that makes it difficult to breathe. COPD is a long-term disease that often gets worse over time and is characterized by inflammation and severe limitation of airflow in and out of the lungs. COPD is an umbrella term used to describe a group of breathing conditions, the most common being chronic bronchitis and emphysema. Many people living with COPD may have both emphysema and chronic bronchitis. A few people have both asthma and COPD. Cigarette smoking is the leading cause of COPD. Long-term exposure to secondhand smoke or irritants such as air pollution, dust, or workplace fumes, and biomass exposure such as wood smoke can also contribute to COPD. An uncommon genetic disorder called alpha-1 antitrypsin deficiency is sometimes associated with COPD.
And that's what we're highlighting in today's show, COPD, rather a chronic obstructive pulmonary disease. But to tell us more, we chat to Dr. Bilal from Melomed out in Cape Town, and appreciate his time once again. And looking at this, of course, and understanding it as a whole, do interact with us. We want to hear your comments, questions, and queries. Our WhatsApp lines are open, so we encourage you to interact. Assalamu alaikum to you, Dr. Bilal, and welcome back to the show once again.
Wa alaikum salam wa rahmatullah, and thank you for having me.
Only a pleasure. I know the last time we spoke, South Africa wasn't in the best of circumstances, and it was like our warriors and heroes like yourselves and the rest of the medical fraternity that took the stand to protect the rest of us, alhamdulillah. So shukran once again for that. And we hope and pray that the second wave is not too close by, but I'm sure you guys are prepared for that as well.
It is. At the current
it
time, it definitely is.
It is. But we're going to have a special show next week, second wave, and Professor Mahdi will expound on that as well. But quickly looking at and understanding this disease and people with any other chronic disease. But firstly, we need to look at COPD and the actual the actual cluster of what obstructive lung disease is. So just in that video, you can maybe expound and just tell us a little bit more, inshallah.
So obstructive lung disease comprises a rather broad spectrum of respiratory disease. As could be seen from the cartoon, we have two lungs, both of which are connected by a main airway that then subdivides and moves air into and out of the lung. Now, obstructive lung diseases comprises diseases that affect those airways. In this group, you have asthma, we have COPD, amongst others, and those are probably the most common diseases found in pulmonology for airways diseases. Now, the term obstruction then characterizes fairly eloquently the predominant feature of this disease. So when patients try to exhale, the airways tend to collapse prematurely, and this causes obstruction, and hence the term obstructive airways disease.
So they have mentioned also the group, the few that does fall under obstructive lung disease, being asthma and emphysema. Those are also stated as chronic lung diseases?
Yes, both of them are chronic lung diseases, somewhat different in regards to the physiology or the mechanism by which they cause shortness of breath, but certainly both are obstructive lung diseases and the most common presentation of airways diseases in pulmonology.
Okay, so let's understand what the symptoms are of COPD versus the asthma.
So I think in both conditions, the predominant symptom is actually shortness of breath. But in chronic obstructive pulmonary disease, patients usually have a progressive decline in their shortness of breath or dyspnea. Initially, you may find that they struggle with strenuous activities like running or climbing stairs, and then this deteriorates to difficulty even carrying out the most basic of activities like changing their clothes or showering. And at the foremost point, the patients are often short of breath at rest. So it's a continuum of or a decline in their symptomatology. Other symptoms of COPD, like emphysema, include chronic cough. Some patients end up coughing up blood, or which is termed hemoptysis, and some patients have recurrent lung infections. Some of the symptoms in COPD are related to associated diseases like weight loss. Some patients go on to features of heart failure, and then even seemingly unrelated symptoms like the fracturing of bones or depression is also a comorbidity of the disease. So COPD, if you look at emphysema, is slightly different or markedly different rather from asthma. Asthma is a very sort of episodic disease. So the patients would look fairly well during the day, and suddenly at night they would exacerbate or develop an intense shortness of breath. So there's significant differences between the two obstructive airways diseases.
The video did show us some of the causes of COPD, but what do we need to know about the causes to help prevent it?
So I think everyone is familiar with cigarette smoking being by far the most common cause of COPD. So cigarette smoke in itself generates significant toxins and oxidants which damage the airways and the alveoli. And I think that is by far the most common cause of COPD. In South Africa, it's slightly different because we see a significant amount of COPD that occurs as a result of tuberculosis. So these are patients who develop tuberculosis and they remain short of breath even after completing TB treatment. And there is an entity of what's known as post-tuberculous COPD, a pretty common condition in our country. Also very common in South Africa is the African cultures in which biomass fuels are used, such as dung in cooking. So often in rural areas, you'll find people cook on an open fire and they use cow dung as the fuel for that fire. And often this cooking occurs within a closed hut, and often the kids and adults sort of congregate within this hut, and the repeated inhalation of biomass fuels results in the development of COPD. So I think cigarette smoking, tuberculosis, biomass fuels are the most common causes of COPD in this country. Alpha-1 antitrypsin is a genetic abnormality, particularly rare, and I don't think it serves as one of the more common causes of COPD.
So with that example that you've just used now, do you then see young people suffering from COPD because of that?
Yeah, so the typical sort of patient who has COPD either fits into an entity of what's called emphysema or chronic bronchitis, but there's significant overlap between the two, and most patients have a little bit of both. Most COPD patients are diagnosed after the age of 50, and in fact, to be diagnosed with COPD much earlier than that is usually associated with non-cigarette smoking COPD, often in patients who have tuberculosis or previous tuberculosis, and in patients who have alpha-1 antitrypsin deficiency. So certainly in the typical smoker above the age of 50, we would see someone with COPD. But yes, it is described in younger populations
Okay.
as well.
And is COPD just about difficulty in breathing?
No. I mean, there are a multitude of manifestations of COPD. Some are related to the lung itself, such as cough, and others are related to the complications of COPD. And these include recurrent lung infections and features of lung cancer. We often take it for granted that the breathing is the most important part, but these patients need to be screened almost annually for lung cancer, because even after stopping smoking, the risk for lung cancer is persistent. And there's a multitude of comorbidities that are inextricably linked to COPD, and this includes osteoporosis, which is the thinning of bones, and cigarette smoking in itself is linked to, as we know, angina and ischemic heart diseases. Some of the other comorbidities include depression and even cancers outside of the lung, cancers of the bowel, cancers of the pancreas, cancers of the bladder. So yes, the spectrum is fairly wide when linked to cigarette smoking, and COPD in itself has symptoms both within the lung and symptoms outside of it.
Let us quickly understand how COPD is diagnosed, Dr. Bilal.
So the diagnosis, most patients will present to you with shortness of breath. So it's a typical symptom. They've been gradually becoming more and more short of breath, and to the point where they cannot do the things that they used to do, such as changing their clothes or bathing. These patients often become isolated in the sense that they now are afraid to leave their homes or to go out, and their life becomes less exposed to the environment outside. So these patients will present with the typical symptomatology, which is part of the diagnosis. Thereafter, we would perform some degree of imaging and some sort of spirometry. Spirometry is the test of testing lung function, and we measure the flow of air within these tubes to calculate or to look at a pattern that is typical of COPD. At the same time, the spirometry is also used to assess the severity and grade of the disease. So that is used for the diagnosis, and then we grade the disease based on symptoms, and we grade it based on what are the values on that spirometry. And that sort of culminates in the diagnosis of COPD.
I want to understand the treatment, and we look at how family and friends can help manage COPD patients with pulmonologist Dr. Bilal from Medimid out in Cape Town. More just after this. Do stay with us.
In normal functioning lungs, when air is inhaled, it travels down the windpipe and into the airways, or bronchial tubes, of the lungs. Inside the lungs, the airways branch out into smaller and smaller tubes called bronchioles that are rich in blood supply. At the end of these tubes are billions of tiny air sacs, called alveoli. Normally, the walls of the airways and air sacs are elastic and flexible in nature. Inhaling causes each air sac to fill with air. Exhaling causes each air sac to deflate. Efficient uptake of air into the lungs provides oxygen to the blood, which is then carried to all parts of the body. In COPD, however, the airways become thick and inflamed, and they produce more mucus than usual. This mucus can clog the airways and makes it hard to breathe. In COPD, the walls of the air sacs in the lungs are damaged and lose their elastic quality. The air sacs get floppy, broken, and lose their shape. As the air spaces get larger, air gets trapped, and there are fewer air sacs to supply oxygen to the blood. Because air is trapped in these air sacs, it is difficult for lungs with COPD to deflate like normal lungs. This trapped air makes it harder to get fresh air into the lungs and makes breathing more difficult.
Welcome back. A very good evening. This is Health Matters, COPD, chronic obstructive pulmonary disease, with intensive care specialist and pulmonologist Dr. Bilal. Dr. Bilal, I just quickly, if you have any comments to share also on the video, and then just quickly, what was described there is often when we talk about COVID-19 patients and even survivors, when the doctors and the specialists come on board, it sounds very similar to what a COVID-19 patient would go through.
Unfortunately not. It's a fairly different disease in the sense that COVID-19 is technically a pneumonia, and it occupies the air sacs that we saw in the video. COVID-19 causes swelling or inflammation within these air sacs. Very little of the disease is actually related to the airways. In a way, it's similar in the sense that COPD usually damages the air sac first and then migrates onto the airways. But in COVID-19, you've actually lost a fair degree of lung volume. In other words, you've lost the capacity or the surface area to exchange oxygen and carbon dioxide. Hence, the patients are markedly short of breath, or they are hypoxemic. In other words, the oxygen level in their bloodstream is particularly low because they've lost the ability to transfer gas from these air sacs into the bloodstream. In COPD, the predominant damage is, although it is in the air sacs, it is predominantly in the airways, and air gets trapped in these airways, making it even more difficult to take your next breath. So you end up with something called air stacking, whereby you have to generate a certain pressure to reopen those airways. It becomes quite difficult. If you think about blowing up a balloon, in the beginning, it's quite difficult to blow up a flat balloon. So in COPD, the airway completely collapses, and it makes it all the more harder to blow up that balloon thereafter because it's lost its elastic tissue. It doesn't have that strength. And you'll note also in patients who have COPD, often their skin has lost that sort of tautness or that resistance, predominantly because the connective tissue or the fibrogen in their soft tissues have actually been lost because of the toxins in cigarette smoke.
Okay, very interesting. I just heard the word mucus and restriction, so I tied it to COVID-19. So let's talk about...
so the mucus is, I must say that the mucus is predominantly because the airway is actually working harder to try and get the toxins out of the lungs. So the compensation for that is over time and to increase the amount of mucus-producing glands in the airway. Hence, these patients, they've lost what's called a mucociliary barrier. And this is a little vacuum sort of system that brushes mucus out of the lung. So they are heavily dependent on coughing to get this mucus out because they've lost that little brush border that pushes mucus all the way up. So the mucus glands are actually a compensation and a mechanism of coping for the lung because of smoke.
Wow, it's all very interesting, and needing to understand how this how COPD is treated. Family and friends needs to be well informed. So let's talk about the treatment and the special team that does have to help COPD patients.
COPD.
COPD.
I think you've been watching too much of
too much COVID.
Okay, so I must say the first steps and the predominantly and actually the hardest steps or the most challenging steps that I find is to get the patients to stop smoking.
Okay.
I mean, no matter what you do, a box of cigarettes used to cost 200 Rand at some stage, and people used to shell it out. I mean, and just carry on smoking. And that is probably the most challenging aspect of treatment, is trying to get the patients to stop smoking. Part of the treatment, we would use psychotherapy, we would use medications, you could use patches, you could use a combination of these to try and get people to stop smoking. But inevitably, it's very difficult when other members in the household are smoking at the same time. Sometimes you may want to consider using an alternative product such as an electronic cigarette or maybe just the tobacco sticks as a bridge, but certainly not to trade one addiction for another. Other treatments are based on changing the mechanics or the mechanism in which the lung empties itself out. And for this, we use inhalers. Some of the inhalers are used to prevent recurrent exacerbations or chest infections. There's three parts of the disease, and one is the actual mechanics of breathing. The second part is trying to control the frequency of chest infections, which is often fraught with recurrent lung infections. And lastly, to try and screen early enough to pick up lung cancer in these patients. At the end stage of the disease, we look at lung transplantation, but that's a very select group and generally reserved for younger patients who don't have comorbidities.
Let's talk about how important it is to make the correct diagnosis for COPD patients.
So firstly, it happens quite often that patients go to the doctor and the doctor hears a wheeze and then they get a pump and that's it, and they label as COPD. I've always been a firm believer in trying to make the correct diagnosis the first time. And I mean, shortness of breath has a multitude of causes for organs even outside of the lungs. It may emanate from the heart, it may emanate from the pulmonary vasculature. Hence, I think we should actively search for these before making a confident diagnosis. Even though this may mean actively consuming resources and costs upfront, I feel in the long term it leads to better outcomes, I think less suffering, and overall I think it is the correct thing to do. Too often we have people running around with inhalers that they don't actually need, they're still short of breath, they go on to another inhaler, they move up and down a ladder of treatment because somebody along the line has labeled them as COPD, but they actually have angina, or they actually have another condition that affects the lung or causes shortness of breath. And we see this in practice. And from a pulmonologist aspect, it's very difficult to withdraw treatment from a patient who's now on 3 or 4 different pumps. It's a very stepwise way to remove pumps and then come back to the initial diagnosis. But I think, in fairness, in patients who have shortness of breath in whom you are going to diagnose them with COPD, you need to have some sort of objective diagnosis the first time. And I think that goes a long way, and it saves a lot more sort of resources and suffering in the long term.
So, Dr. Bilal, we want to look at the way forward for COPD patients, and especially in the light of our recent, still pandemic, and the possible look at the second wave coming up.
I must say, I mean, I realize people are tired and people want to enjoy Christmas and people want to start socializing. And it has been a rough year for all of us. But the numbers are increasing. I have a fair number of admitted patients, some on ventilators, some on oxygen. And certainly the numbers are starting to peak. And it is not the time to be complacent. It is the time to maybe even go back towards lockdown. I know the economy is going to suffer harshly, but I think it's time to start going back to our social distancing. And I think people have become extremely complacent at this point in the year. And yes, the second wave is here. It is here. We did speak about it, and it is here. And it definitely, the numbers are climbing at the current time.
Dr. Bilal Abdul Ghafoor, specialist physician and intensive care specialist out at Gatesville in Melamed. We say a big shukran for your time and information you've just spread light on COPD, and in light of just hearing what Imam Fahim is saying of musallis still visiting the masjids or masajids and then taking the necessary smoke that they need to do outside. These individuals need to stay at home and if need be, protect, yes, a must to protect others. So smoking is one of the leading causes of COPD, as our pulmonologist has expressed, and we need individuals and the rest of the family, the community, to stand by these individuals and help them treat COPD effectively. Jazakallah to you, Dr. Bilal. All the best with, as you said, the second wave is already here. Our heaters are standing by, and may Almighty give you the necessary strength and patience to cope through this second wave pandemic. All the best to you and your team, Dr. Bilal, and the rest of the Melamed staff as well. Assalamu alaikum to you. So there we have it. Officially said by pulmonologist, the specialist in the intensive care unit at Gatesville, that the second wave has hit Cape Town. He's got quite a few patients already in intensive care. Please, 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 all we ask is to protect others by following the social distance, wear a mask and sanitize. From myself, Hawa Sonoman, and the rest of our team, wassalamu alaikum and a very good evening to you.